Dr. Roy Picard, DC with Michigan Integrative Health, and I'm going to relay information that is recommended by Michigan Integrative Health once you receive your care for a knee, back, or even hip. Think in terms of healing and repairing. We are able to provide the care, but as you know, healing takes time. So the best thing we can recommend is to try and avoid interfering with that process. We're not recommending that you go home and lay in bed all day. The level of activity you should participate in will depend on such factors as your overall level of health, how active you were previous to your care with us, and how much damage exists in that area that you received the care. Obviously, everyone is different, and we spend the necessary time during your consultation and examination explaining to you the recommended guidelines that are specific for you. Generally speaking, we want you to avoid heavy stress into the joint. Light walking, going to a store, walking around the house is not going to be a problem for most people. If previous to care and previous to your knee pain, you were often finding yourself at a gym, let's say lifting heavy weights, or if you are a person who loves to run a lot or play a lot of sports, immediately after care, we will want you to kind of curb those activities down for, let's say, maybe a week or so and allow the healing to begin. It doesn't mean that you can't go to the store as necessary, but taking unnecessary trips, going for walks, riding on a bike, skiing, those are the type of activities we would want you to hold off on, again, for about a week or so. Can you still go to work? Well, as long as your job doesn't require you to put heavy stress into the joint that we're trying to help you with, there shouldn't be a problem. Sitting at a desk, some light walking, it's not likely going to be a problem for most people. Now, if your job involves climbing telephone poles or climbing on roofs or lifting car engines by hand all day, those are things that we would want you to refrain from for a while. And again, we will monitor how you are coming along through phone calls and follow-up visits, and in time, have you safely increase your levels of activity and get you back to where you can do what you love to do and get your life back.